Hello, everyone, and welcome to the Celiac Disease Program at Children's National Medical Center. I'm Vanessa Weisbro, the Executive Director of our program here, and I'm excited to present to you today our Back to School with Celiac Disease workshop. If you have any questions along the way, you can submit them to us either in the question box or the chat box. There are also 4 handouts that we posted under the handout section, so be sure to download those. There is a sample 504 plan as well as some documents that will help with training of schools to manage the gluten-free diet. So let's go ahead and get started. Today, we are going to talk about managing celiac disease in a learning environment. It might be a school, it might be a public school, a private school, a preschool, or even a daycare center. So what we're going to talk about today will apply to lots of different child settings. We're hoping that by the end of today, you will have yourselves equipped with a standard set of accommodations to provide for a safe physical and emotional learning environment for your child wherever they may be learning. We have a packed agenda, so I'm not going to go through each line item, but I think you're going to really appreciate all of the topics that we are going to discuss today. I want to start out by just sharing some messages that we hear from parents across the country. Our celiac program has been working with schools for the past 10 years, and I think we've probably come across almost every situation that you can probably come across in a school environment. So I'm just going to share a few of them so that you know that you're not alone. My son asked to go to the bathroom 3 times. The teacher kept saying no because he had already used the bathroom pass during the class period. A few minutes later, he had diarrhea in his pants and was so embarrassed he doesn't want to go back to school. We get about 1 of these a week where the child has had an exposure, is having stomach issues, and the teacher doesn't allow them to go to the school. It happens more frequently than you would think, and it's something that we want to make sure doesn't happen to any of our children. My 6th grader was told he had an excused absence from the class outdoor education trip because they don't accommodate gluten-free diets at the campsite. He goes to a public school. Is this legal? I don't want him to miss out. Unfortunately, we have dealt with this experience 3 times during the past school year. We never want a child to be left out of a learning activity, and outdoor education is a really big part of children going through middle school. My daughter's school said she doesn't need a 504 plan because they are experts at managing kids with food allergies. But last week during lunch, they fed her regular pizza and she was sick for days. I don't want to offend anyone, but something needs to change. And for this reason exactly is why your child needs a 504 plan, because it's documented and it makes sure that it happens. My daughter's teachers are wonderful about her gluten-free diet, but yesterday she had a substitute teacher who refused to let her use the bathroom a second time. She had an accident and is so embarrassed to face her friends on Monday. Unfortunately, sometimes substitute teachers are called in at the very last moment and they aren't always educated on all the needs of the students in the classroom. So it's really important that there is a method for the administrators to communicate to the substitutes about children who might need special accommodations in the classroom. So why are we all here? We want to promote a better understanding about needs of students with celiac disease. All of you listening most likely have a child with celiac disease or know a child with celiac disease that needs accommodation, but we want to talk about what those needs are and why they have those needs. We want to encourage really good communication between parents and guardians and the school officials about what a child with celiac disease needs. And we want to work to establish reasonable accommodations for these kids so that the schools don't look at families and say, oh, they're being crazy asking for all of these things. But at the same time, that the parents feel that their children are being taken care of. So we want to make sure that we have this set of reasonable accommodations to expect for our kids with celiac. So I'm going to talk just for a few minutes about some facts about celiac disease at school. As all of you listening probably know, celiac is a genetic autoimmune disease that affects about 1 in 100 people or children, making it one of the most common conditions in the country. There are approximately 74 million school-age children in the United States. Thus, using this math, there's about 740,000 school-age children living in the United States with celiac disease. Approximately 49% of children who have celiac disease also suffer from anxiety, including separation and social anxieties, pessimism, and excessive worrying. Celiac disease affects learning, and we know this. We're now going to talk about a lot of ways in which celiac disease affects learning. This is all information to equip you with details to help speak with your child's learning environment about what could happen if a child is regularly exposed to gluten. These slides are not meant to scare you, and they're not meant to make you think that your child cannot go to school safely. It's quite the opposite. We are just trying to give you the information to help make sure that your child's school understands the importance of setting up reasonable accommodations for your child and how to prevent these things from happening. There are physical and emotional symptoms of celiac disease that can affect learning and could impact their ability to grow academically and socially. As you all know, there are over 300 different symptoms of celiac disease, oftentimes vomiting, diarrhea, skin rashes, headaches. These symptoms can be extremely anxiety provoking, embarrassing, painful, and distracting. I have a 5-year-old with celiac disease, and within about an hour of eating gluten, he starts vomiting very badly, and he gets really upset and emotional about it. He doesn't like the feeling of throwing up. He's embarrassed that people have seen him throw up, and that he doesn't always know how to control himself enough to get to a bathroom in time. So it really affects his ability to be engaged in a situation when he's really concerned about the symptoms that might happen to him. Like I said, because of these fears, my son or any student with celiac disease, he might be unable or unwilling to attend school if he feels as though he's going to be contaminated with gluten. And the times that my own child has been exposed to gluten, he now doesn't want to go back to those situations again because he doesn't want to get sick again. So this is why we want to keep gluten out of their systems, particularly in the school environment, so that they aren't having these reactions in a place where they are going to feel embarrassed by it. These physical and emotional symptoms can negatively impact a student's ability to focus, to learn, and to perform at their normal level. Just think about times when you've felt sick. It's really hard to concentrate and to absorb new information when you aren't feeling well. So this is just another reason why we want to make sure that these kids are not exposed to gluten in the school environment. When children with celiac disease are not accommodated appropriately, they can often feel left out. Let's go back to talking about that situation with outdoor education. The school thought they were doing the right thing by giving the child an excused absence and not counting it against his grade for not participating. It was an easy way out. They didn't have to provide gluten-free food, and the child didn't suffer academically. However, what that child did experience was feeling excluded and isolated from the rest of his friends at school. He's a 6th grade boy. This is a really high time for emotions, and excluding him from that activity was not the right approach and can easily be prevented, which we're going to talk about more in a minute. It's really challenging for kids to participate in class lessons that involve food or materials that contain gluten, especially when it comes to eating meals with peers or participating in celebrations or going on class trips. So by providing accommodations, we're able to take away this feeling of exclusion and isolation and to really allow these kids to participate fully in the learning experience. Being left out isn't just something that feels bad, but it can really interfere with academic and social development for all kids. We want to make sure that our kids with celiac disease are not having that happen to them, and so providing accommodations is what needs to happen. I hate tossing around the word bullying, but it does happen, and it doesn't only happen with other kids. It also happens with parents. On the kids' side, sometimes kids with celiac disease or other food allergies or other chronic diseases can attract negative attention by having different foods, by asking a lot of questions, or having symptoms that others notice. So we want to prevent that from happening, and by providing simple accommodations, as we are going to talk about in great detail shortly, we're able to prevent this from happening and make our kids feel really included and a part of the learning activities. On the other hand, we hear a lot from families that students who are asymptomatic, a huge number of kids with celiac disease don't have any noticeable symptoms. Some may have just had anemia at diagnosis, and others were just diagnosed through routine screening. So some people may doubt that they actually have celiac disease because they don't see any symptoms, and therefore they might not take it as seriously. We've heard of kids being teased or taunted by their peers, by teachers, coaches, and most often from other parents. So what we really want to encourage is simple education to help your entire community understand the importance of accommodating celiac disease and how easy it really can be to prevent all of these things from happening. So now I'm going to talk a little bit about where we find gluten at school. We found from our clinic that about 44% of children and teens don't follow a strict gluten-free diet, and most often the consumption of gluten happens when they're eating with their friends. We find that a lot of kids are exposed to gluten at school during class celebrations and with cross contact with gluten-containing materials, such as things like Play-Doh and paper mache. Kids with celiac disease who feel less integrated into their activities, so those who do not have accommodations, tend to be less likely to succeed on the gluten-free diet, which is why we really want to get good accommodations in place for them so that they are able to succeed in a really positive way. And as we all know, and I'm sure you've all heard from your GI doctors, non-adherence to the gluten-free diet can lead to both negative short and long-term health consequences. So the short-term meaning immediate symptoms like diarrhea and vomiting, or headaches, or whatever it is the symptoms that your child experiences, but also long-term complications like developing other autoimmune diseases. So it's really important that we make sure the diet is properly accommodated. It's really important to me that everybody watching this understands that all families and learning environments, meaning your child's school or daycare center, wherever it is that they go, really think about these factors as they develop plans for managing celiac disease in the classroom or learning environment. It is possible for every child with celiac disease to participate in every learning activity with very simple changes. I know it can seem overwhelming to school districts where there are 20 to 25 kids in a classroom, but with really basic changes like providing rice for an activity instead of a wheat-based ingredient, they can allow every child to participate safely and get the same level of engagement out of a lesson plan. So now I want to go back to those examples that we talked about in the beginning. My son had to go to the bathroom 3 times, the teacher didn't let him go, and he had an accident. So what is an easy way to get around this? Kids with celiac disease often have urges to use the bathroom. So if we just let their teachers know this, that a child may really need to go to the bathroom multiple times, then the teacher will know that this child is probably not just trying to get out of class, but really does need to use the bathroom. So a little bit of education can go a long way in helping prevent these accident experiences. So the outdoor ed trip where the child was told that they were just excused from it, the answer to this is that if the child had a 504 plan in place, then this is not legal at all. The school must provide accommodations, and our team was actually able to resolve this conflict. After meeting with their conflict and resolution office, the school did agree to supply the meals from the district's home-based kitchen, and then provide those meals to the outdoor education site so that the child could participate. So it did end up being a good outcome to this story, and we have been able to get all 3 situations this year accommodated appropriately. So not needing the 504 plan. So this happens all the time, and this is exactly why you need a 504 plan. It needs to be written down what the accommodations are and how that student can access the gluten-free food. If it's not in writing, there's not a written plan, and let's say the person who typically provides the food is away that day or out sick. There would need to be a backup plan to make sure that that child could always get access to the food. So having it written down is really the best way to go. The substitute teacher situation. There should always be a communications plan, and in a 504 plan, there should be documentation about how the administrators will communicate to substitute teachers. So again, this is something that should be documented and should be easily accessible to all substitute teachers. So now I've talked a lot for the last 10 minutes about these accommodations, but how do we get there? So first, we're going to talk about federal laws and regulations that govern celiac disease. There are multiple different things that govern it. First is the American with Disabilities Act of 1990. This act defines a disability, and it defines it as a physical or mental impairment that substantially limits one or more major life activities. So eating and majorly bodily functions are considered part of this, and that would include digestive and immune systems. So that would automatically put celiac disease underneath the Americans with Disabilities Act. And of course, as I mentioned, celiac does qualify for protection under this law. Then we have Section 504 of the Rehabilitation Act of 1973, and this prohibits discrimination in all institutions receiving federal financial assistance, including schools, on the basis of disability. So this means that a school or any institution that receives federal dollars cannot discriminate against a child or anyone with celiac disease. And it actually requires that institutions that provide educational programming, that they design it to meet the student's individual educational needs as adequately as the needs of a non-disabled student are met. So if they are providing food to kids who don't have celiac disease, they must also provide food to kids who have celiac disease that is safe for them to eat. The other important thing to note under this Rehabilitation Act is that it does require reasonable accommodations that must not drastically alter the structure of the educational institution. So, for example, in the lunchroom at a public school, that school must provide gluten-free food, but it doesn't have to be matching gluten-free food. So they don't have to provide a gluten-free pizza or gluten-free pasta. They must only provide a reasonable accommodation. So there is an argument for reasonable nutritional value, so a carbohydrate or fats or proteins, that they should meet those goals, but that it does not have to be a matching accommodation. So it doesn't have to be pizza for pizza, pasta for pasta, bread for bread. It just has to be a reasonable accommodation of the food provided to students who do not have celiac disease. So now, what if your school suggests an individual healthcare plan? So this happens very, very often. These plans are meant to deal with medical issues, not learning issues in the school setting. They are drafted by the school nurse. They are not legally enforceable, and they do not offer formal classroom or cafeteria accommodations. So that's the big difference, is that a child with celiac disease needs accommodations across multiple different areas of the school environment. And so that is why, well, also in that we want the legal protections, we would go to a 504 plan. So why choose the 504 plan? It's a legally binding agreement between the parents and the school district. It addresses accommodations in academic areas, but also can be applied to non-academic areas and extracurricular activities that are sponsored by the school so that the student can experience the entire school environment. So before we get to the actual accommodations, which I know that you're all dying to see, I just want to talk quickly where gluten is found in schools so that as we get to the accommodations, you're thinking about those places that you might need them for your child. So let's start in the classroom. There are sensory tables that have gluten-containing grains and pasta. There are art classes where materials are used like pasta, collages with grains. Play-Doh, the commercial brands contain wheat flour. Paper mache is typically made using wheat flour. There are science projects. There's lots of schools that are doing projects now where they're looking at baking breads and cakes and seeing how baking powder reacts in them. The recipes themselves contain gluten. There are lots of schools doing projects with baking sheets where they're baking gluten-containing foods on different types of baking sheets to see if the material of the sheet impacts the baking. Cooking and home ec classes, or as they're now called, family consumer science classes. Gluten is in many of the ingredients that are used. Then there's also the potential for cross contact with dirty utensils or workspaces, even if the child is using gluten-free materials. As we've talked about, there are special celebrations and festivals where food is involved. You will want to know well in advance if these are happening so that we can provide accommodations for making sure the child can participate. Of course, in the cafeteria, there are lots of places where gluten can be found. Things like gravy, marinades, salad dressings, where there's no labels. Shared utensils can contaminate an item that's gluten-free. On the tables, students eating sandwiches or other gluten-containing items, and there are crumbs left on the table. And then in the actual preparation areas, there are items that are cooked in the shared environment. And there's no easy way for the kids to check whether or not they're safe, especially on these buffet bars where everything is in bowls. Now, let's get on to those accommodations that I've been talking so much about. So we are advocating for the celiac disease management plan, and we feel really confident that this is the way to help kids get the appropriate accommodations in the school and learning environments. Um, we developed these guidelines with a group of 44 experts. We brought them all together in Washington, D.C. to develop recommendations for kids with celiac disease. On July 22nd of 2019, our group adopted these voluntary recommendations. We developed them from research. We had clinicians from 10 pediatric hospitals. We had education professionals, legal experts, and affected patients and families. These recommendations are meant to be applicable in many learning environments. They will be schools, public and private. There'll be home-based childcares, daycare centers, and facilities that do and do not receive federal funding. So they will be applicable to 504 plans, but also to other plans that different learning environments use. The recommendations are aligned with other national guidelines for managing chronic conditions. So we looked very closely at the food allergy, diabetes, and asthma recommendations and really tried to model ours after those so that schools are seeing them in a format that is similar to how other chronic conditions are managed in the same environments. We also used common terminologies and practices around sanitation from these other resources so that it's not something new that schools are finding. And then we defer to existing policies, definitions, and guidelines. For example, the FDA's definition of gluten-free and the Family Education Rights and Privacy Act in regards to how these institutions can identify kids that need accommodations. So this management plan has 4 key sections. I'm going to first say that as I mentioned already, that these recommendations are intended for developing an individual 504 plan, but they may be useful, as I said, for other types of plans used in learning environments, and they may also be used for other children who have medical conditions that require a gluten-free diet. And like I said, they are meant for 504 plans, but they can also be used in many, many other situations where the 504 plan is not the standard approach. So as I said, there are 4 key sections. Section 1 deals with formal training for personnel who work with children in the various different learning environments. Section 2 talks about educating children and families about celiac disease. Section 3 looks at the daily management, and that is the heart of the accommodations that we're going to talk about. And section 4 is developing a plan for when a child is exposed to gluten. So section 1 is formal professional development on celiac disease. So we broke this down into 2 different sections. First, to provide general training and resources on celiac disease and the gluten-free diet to all staff and personnel with formal arrangements to work in the particular learning environment where your child is. So this general training would include an overview of celiac and the gluten-free diet, an understanding of key terms, signs and symptoms of a gluten exposure, general strategies for reducing and preventing exposures, policies on how the institutions handles bullying and harassment and how those would apply to a child with celiac disease, and then understanding the policies and practices of the institutions regarding management of celiac disease and the gluten-free diet. So this is considered general training for everybody at the institution where there may be a child with celiac disease. Now, we've broken it down further for in-depth training for health staff in schools and those who are directly responsible for the child with celiac disease. So the teacher, for example, who has a child in their classroom with celiac. So we would want them to understand federal laws. We would want them to understand materials that contain gluten and how kids are commonly exposed to them, short and long-term effects, strategies for building an inclusive environment for these kids, safe procedures for storing and accessing gluten-free foods, reading labels and identifying gluten in products, proper methods for washing tables, hands, any surfaces that might have touched gluten, the importance of not allowing children to share food, how to respond to an exposure, including notifying the parents or guardians, and how to help a child handle symptoms that they are experiencing as a result of the exposure. Section 2 goes into educating children and parents and guardians about celiac disease. So the first part of this is educating other children. Now, we are not suggesting that your school do a big training for kids about celiac disease. We're just talking about including information into existing healthcare modules where they would talk about other conditions such as food allergy, asthma, or diabetes. We want this information to be appropriate to the age and developmental level of students, and perhaps include topics such as understanding why some children are unable to tolerate certain foods, why it is wrong to bully or tease others who are managing a special diet, how to find a teacher or other adult who can help a child who is experiencing a gluten exposure or who is feeling ill. And these would be skills that are applicable to really any child who might not be feeling well at school. And then an understanding of why it's important to only touch or eat one's own food during snack or meal times. Now, all of these things are very basic learning points for kids that can be applicable to many situations beyond celiac disease. Part B of Section 2 deals with teaching parents and guardians and other families at the school about celiac disease. So really the success of these accommodations relies on the support and participation of families with and without celiac disease. And again, we're not suggesting doing something totally new. We're just suggesting including this information in other education about food allergies, asthma, or diabetes. So just the way that they're already doing it, or if they're not doing it right now, developing educational materials on all the chronic conditions that are managed at school so that parents really understand. I know that as a parent, I really want to understand how to help make my son's friends feel included in everything that we do. So it's something that I would be very open to getting, and I'm sure all of you listening would be as well. So here are the things that we suggest being a part of this training. We want parents to understand how the institution is preventing exposure to gluten for kids with celiac, how parents can help build an inclusive community for all children with celiac, as well as other chronic health conditions, and then how the school has set up protocols and policies for preventing bullying and teasing of students with special dietary need or other health issues. So again, most of this is really good education that all parents should be getting, just having their kids in school, period. So as I mentioned, Section 3 is really the heart of these accommodations. I'm going to start by talking about 3 ways that some learning environments are handling kids with celiac disease, but then we're going to go through lots of accommodations. So some institutions have implemented a no food policy. This means that there's no food that's used in the classroom or learning activities for celebrations or festivals or reward. And this just really limits the exposure to food outside of the cafeteria and makes it really easy for kids to participate in the classroom because there's no food. Now, it's important to note that even with a no food policy, this would not mean no materials that contain gluten. So there may still be instances where they're using materials that had a gluten containing ingredient in them. So it would be important to still look into that. Some institutions are allowing parents to provide a gluten-free option for the child with celiac disease so that there is a gluten-free version of whatever food is being used for other activities. This does allow kids with celiac to participate in all of the programs, but it does require very careful attention to make sure that the gluten-free option is offered free of cross-contact from gluten-containing ingredients that are being used or eaten by other kids. So again, something that you'd have to watch out for. Finally, some schools are making the classrooms gluten-free, peanut-free, and common allergen-free. This method does allow children with celiac to participate without being identified as having a special dietary need, which is good, but this is also not necessarily realistic in the real world, and so it doesn't necessarily teach the children how to be advocates for themselves. But again, it does allow for a way for the kids with food allergies to participate fully in the activities. So now we are going to go through lots of accommodations, and we've broken them down into 3 different sections. The first is looking at classroom activities or learning activities. The second is eating spaces, and the third is offsite activities. So there's quite a lot here, and you will be able to download this table later, so you don't have to worry about getting everything scribbled down, but I do want to talk through it. So I'm going to read through these accommodations. and just give a little bit of context for them. So this is the table that looks at classroom and learning environment accommodations. Not all of these will apply to every child or to every institution. So we're not suggesting that you send these lists of accommodations and say, my child needs every one of them. We're suggesting that you read through them and personalize them, which we'll talk about on the sample plan that we get to in a moment. But really think about the places where your child needs accommodations and pick the ones that will really apply to their environment. So avoid the use of gluten in class projects, arts, science experiments, and other learning activities. We would hope that teachers would do this. It's a great way to be inclusive of kids. But if they can't avoid them, then provide a gluten-free option for the child with celiac disease, because we want to make sure that that child is included and not excluded from the activities. We recommend using non-food incentives for prizes, gifts, and awards so that every child can have the same. As appropriate to their age and ability, help children with celiac disease read and understand the labels of food provided by others so they can learn to avoid ingesting gluten. We do think it's really important that teachers don't just say, nope, you can't have that, but help children understand why. If food is provided by families in the classroom for an outside activity, we ask that the school provides 48 hours of notification to you, the parent or guardian of children with celiac disease, so that you have time to think about appropriate accommodations. And we hope that when they notify you, they will let you know what those food items are. So in many cases, the parents of other kids in the classroom have really good intentions and want your child to be accommodated and to be able to participate. So they may be providing food that is gluten-free. They might also be making homemade gluten-free muffins, and you might feel comfortable with your child eating them, and that's okay. We just want you to get that information in a timely manner so that you can make the best decision possible for your child. So if you are storing meals or snacks at the school, we ask that schools have a designated space for storing this food that would be separate from gluten-containing foods. We want your child with celiac disease to wash their hands with soap and water before and after eating. We also want children with celiac disease to wash their hands with soap and water after touching materials that may have contained gluten. We want you, the parents of children with celiac disease, to provide gluten-free snacks or treat items to be stored or kept in the classroom so that in case of an unexpected activity, there's a backup for your child to have to still participate. If there's a child with celiac in the classroom, we want the school to have clear instructions for substitute teachers. If food is ordered from a restaurant or outside vendor, for example, Pizza Fridays, which is probably the most common one, we want the school to consult with you, the parents and guardians, to develop a plan. This might include ordering a gluten-free pizza or gluten-free meal from the restaurant that is being ordered if you feel that they do have the knowledge to provide it safely. Or there may be another solution, such as bringing that food from home or picking a different accommodation. We ask that the schools notify parents or guardians for at least a week ahead of time if there's going to be a learning activity that may require an accommodation, to give plenty of time to develop the accommodations. And we ask that they notify you in the method that is consistent with how they would notify you about other activities or procedures. And finally, the last few here for learning or classrooms. Oftentimes, classrooms are used for other community functions like parent-teacher associations or community groups. We want to make sure that these organizations are notified about policies and practices of using food in those spaces so that they're not bringing nuts or flour into the classroom and then not cleaning it appropriately. And if for some reason they do bring those materials in, that the space is properly cleaned before the child with celiac disease is back in that space. In the instance where there is a suspected exposure, we want to make sure that those exposures are being reported to a designated staff member and to you, the parents and guardians, as soon as it becomes known. And then finally, in the case of a suspected exposure, regardless of whether it happened at home or at the institution, we want to make sure that the child with celiac disease has unrestricted access to the bathroom facility and or the health counseling staff to get the appropriate care that they might need. All right, so moving on to accommodations and eating spaces, we ask that the food service provider offer reasonably equivalent gluten-free food options for the children with celiac disease, and that these foods are cooked using methods to prevent cross-contact with gluten. We ask that all gluten-free food meet the FDA's definition of gluten-free. We ask that the food service provider review labels of items served to children with celiac disease for gluten-free ingredients every time they make a new purchase. If for some reason food is provided in the eating space by a family, we want to make sure that there's again 48 hours notification so that you can make an appropriate determination if your child can eat that food or not. If the institution is preparing the food, we want them to designate a gluten-free preparation area with either dedicated or appropriately sanitized tools. If that dedicated area is unavailable, then we want clean preparation areas thoroughly before making gluten-free foods. We want the food service provider to provide copies of menus, including the gluten-free options, to parents and guardians at least 1 week prior to serving so that you have time to meal plan. And many schools are actually doing this a month in advance. We want the food service provider or cafeteria staff or whoever is responsible to clean the eating surface where the child with celiac might eat so that the child can, like other children, choose where to sit during eating times. The idea here is to get away from the allergen table for kids with celiac disease. As long as they're in a clean space and eating their own food, there's no reason they can't eat with their friends. We want to encourage children and staff to wash their hands with soap and water before and after handling food, because this is the right thing to do for sanitation, not just for gluten-free food handling, but for everyone in general. We want the food service provider to share recipes, food labels, and ingredient lists of foods used to prepare gluten-free meals as requested. So if you, as the parent, want to know what's in the recipes, what's on those labels, they should be able to provide them to you. And then we want them to maintain copies of these labels for at least 48 hours after serving the food in case there is a suspected exposure. The food service provider should also have an up-to-date list of vendors and manufacturers to talk to them about ingredients. And then we want to provide copies of meal menus, including gluten-free options, to parents or guardian at least 1 week prior to. And then finally, we want to develop a standard procedure for identifying children with celiac disease who need to be served a gluten-free meal that's consistent with the FERPA law, which I talked about earlier. And this is basically something that all schools are doing anyways, is that they must identify the child somehow so they know who to give the gluten-free food to. But we want to do this in a way that isn't outing them to the entire community. We want to report all suspected exposures immediately upon awareness. If the food is prepared on site at the institution, we want to make sure that there's a designated staff member to oversee upkeep of all of the gluten-free food items, ordering and serving, so that we are not bouncing back and forth between multiple different people, and that there's a backup person in place in case the primary person is away. If your institution is required to maintain an emergency supply of food based on state and local laws, then also have food for the child with celiac disease. Many states do not have this as a requirement, and if your school is not required to keep food for everybody, there will not be this requirement for children with celiac disease. And again, in the case of an exposure, regardless of where it happened, please make sure the child has access to the bathroom and counseling and health staff. Now we're going to talk about activities such as field trips and other off-site activities. So, of course, we want to avoid off-site activities that would exclude children with celiac disease from participating safely. We want to engage you, the parents and guardians, in planning for these activities. If food will be provided by an outside vendor, then we want to notify the vendor of the gluten-free needs and get a detailed writing plan that details how they are going to accommodate the gluten-free meal. If the institution will provide food for an off-site activity, meaning that the school cafeteria is going to provide it or the district kitchen, ensure that meals and snacks are packaged in a way that prevents cross-contact with gluten and that they are clearly labeled as gluten-free foods. If you, the parents or guardians, will provide the food, then we want to make sure there's a method for safely transporting and serving the food to the kids so that it's not being contaminated and that you're certain that your child is getting the right food. We also want to make sure that chaperones and staff who are going on the trip are informed about this accommodation plan for the child with celiac disease and that the right food is getting to them. Additionally, we want to make sure that the parents and guardians are notified of accommodation plans at least 1 week before the activity so that you have time to make changes or modifications. And then we ask that the school or learning environments consider inviting you to accompany the child on the trip that might require these accommodations. And finally, as we've mentioned in the other two categories for accommodation, we want to make sure that all suspected exposures are reported immediately upon awareness. So now we talked a lot about cleaning, but what do we recommend? So initially we had started out with a checklist, but then as we got deeper into this process, we found that there are very, very strict local food safety and sanitation laws that schools have to follow. And so the schools are already trained in these practices. And so we made slight modifications to add specific things to gluten-free, and these will all be provided in the handouts. But for the most part, the basic gist here is that the schools are required to do this anyways, and that as long as they are following the laws to prevent bacterial contamination, that they are able to very well protect against gluten cross-contact. So now section 4, planning for exposures. So the exposure may or may not have happened at the school or learning environment. As you know, it can be many hours between a child eating gluten and them having these symptoms, but it doesn't matter. If they are having exposure in the learning environment, it should be appropriately handled. So the first thing is we want to make sure that the parents and guardians are notified as soon as they know that symptoms are happening. We want to provide unrestricted access to the bathroom facility and or health and counseling staff so that the child is sure to get the support that they need. In terms of seeking further medical attention, this is something that we get asked about all the time. So when should a school seek further attention? If the child is vomiting continuously, they appear to be severely dehydrated, they're reporting severe abdominal pain or distension, and if they're reporting symptoms that are not typical of that child's normal reaction. So celiac reactions happen, and it's not always necessary to go to the doctor or to go to the hospital. So we want to make sure that there's a good understanding of when additional medical attention might be needed. And finally, I can't get the answer to that. Finally, once the situation is stabilized, we want to make sure that a designated staff member reviews what happened with the exposure and the response to that exposure so that we can prevent that happening again in the future. All right, so now we're going to look at how this might actually be implemented. So this is a sample plan that we have developed for Brandon Smith, a fictional child. He is entering kindergarten this fall. So the idea here, the purpose of this plan is to educate the primary center about celiac disease and the gluten-free diet, and to develop a set of reasonable accommodations that will allow Brandon to fully participate in all parts of the educational and social experience. So in the overview part of this document, you'll see that we talk about when he was diagnosed with celiac disease, what celiac is, how the diagnosis was made, what the primary symptoms are, and what to look for during his suspected exposure. Then we talk briefly about what the treatment is for celiac disease, meaning the gluten-free diet, and what needs to be avoided. And this goes into great detail. I'm just showing you the brief versions of it, and you can download the full sample plan in the handouts as well. Now, this is what a accommodation plan would look like. So there are 3 columns here, and again, you can download this document and you can fill in as appropriate to your child's school. So as we went through in the presentation, it's broken down between classroom and learning environments, eating spaces, and field trips and offsite activities. As you can see, there are certain places where we've made modifications. So for example, in column 1, Brandon's parents will provide gluten-free snack and treat items to be stored in the classroom or other agreed upon storage space in the event of an unexpected activity. So that was putting the responsibility on Brandon's parents so that they are going to provide these things. In the second column, in eating spaces, Pomptonian, who is the food service provider at Brandon's school, should offer reasonably equivalent gluten-free options for Brandon that are cooked using methods to prevent cross-contact with gluten. We added a bullet point: do not serve branded packaged food unless it has a gluten-free label. Review labels of food items served to Brandon for gluten-containing ingredients. At the primary center in the last bullet, if food is prepared at Wilson Primary Center's kitchen, we want them to designate a safe area. So as you can see, this goes through very specific things for this child. It doesn't include every bullet point because his parents didn't feel that it needed to. So you should really look at all of the different accommodations suggested and pick those that you think are really relevant to your child being in a safe and inclusive environment. So for the exposure plan, we document when he's exposed to gluten, he won't experience life-threatening symptoms. However, he may experience diarrhea and vomiting. So those are his normal symptoms. So if he experiences something other than that, that's when you would seek further medical attentions. So this is really important. And then it's also really important to make sure that we're giving resources to the school. So as attached in the handouts, we have gluten-free, safe, unsafe, and questionable foods. We have tips for the school cafeteria, a document about preventing cross-contact, a guide to gluten-free flours and grains. And then finally, we have a list of Brandon's favorite foods because we want the school to think about things that he might like when they're picking choices for him to eat. So we find that it's a really good idea for parents to provide a list of things that their child really does like so that the school is thinking about those. So now here are just a few simple ideas for accommodations in the classroom. Teachers often ask for these types of things, and so we wanted to give you the information. In sensory tables, they could use rice, dried corn, beans, or gluten-free pasta. In art classes, use gluten-free pastas, collages with naturally gluten-free grains like rice, quinoa, corn, or beans. Use alternatives to modeling doughs that are made from wheat. So for example, Crayola has one that's made from rice, or make your own using rice and cornstarch. Paper mache can just as easily be made using rice flour as it can wheat flour. Science projects, try naturally gluten-free projects like growing rock candy crystals or emulsifying with oil and vinegar, making your own bubbly water drinks, or making butter using different methods. There are lots of cool science projects that do not need to use gluten-containing materials. Cooking with kids, try naturally gluten-free recipes or get an all-purpose gluten-free flour for all of the kids to use. These are just some cute little pictures. As you can see on the left, this is kids playing with Play-Doh. As you can see, it's all over the table and not really easy to keep it separate. So using a naturally gluten-free version is typically the easiest. And then cooking with kids, here, this whole class is making gluten-free strawberry ice cream with just milk, sugar, and strawberries. So again, a very simple way for kids to still get the experience of cooking, but using ingredients that everybody can enjoy. So now we're going to talk about your role as parents. So here are the things that we believe parents should have on their action list to be doing with a child with celiac disease. So first of all, you should notify your child's school principal as well as the school nurse, psychologist, or guidance counselor and teachers that your child has been diagnosed with celiac disease. Or if they don't currently have a plan in place, you should do this at the beginning of the year or at any time you feel necessary to have the plan be put into place. You should work with your child's celiac disease healthcare team to develop a management plan. This might be a 504 plan depending on the school, and you can base it upon the sample plan that we have provided. We ask that if you would like support in doing this, that you permit the sharing of medical information for your child's safety between your school and the healthcare providers. For example, our celiac program has dozens of meetings with schools every week, and in order for us to participate in those meetings, it is necessary for the parents to allow us to discuss the child's diagnosis with the school. So if you want our team or whatever team at the hospital where your child is handled to engage with the school, you will need to give permission for them to speak with the school. You're going to want to provide accurate and current emergency contact information to the school and update them of any changes. You're going to want to attend and participate in the initial and annual meetings of the school health team to discuss implementing the requested accommodations that will come in the management plan. You will want to understand and be very knowledgeable about these federal laws that we talked about today, and hopefully you are now that we have talked about them. You're going to want to review all of the information in the Managing Celiac Disease in Learning Environments, which are the recommendations that we went through today, and you can download as well. You'll want to inform the nurse or other school staff about any changes in your child's health or symptoms so that they know what to look for. If you have agreed to provide any supplies to the school that are considered parent supplies, please actually provide them. This might be the snacks, treats, materials, whatever it is that you have agreed to supply. Make sure to let school staff know when your child plans to participate in school-sponsored activities that take place before or after school or off campus so that the appropriate accommodations are coordinated. And make sure to discuss privacy and confidentiality with your child. Some kids don't want others to know that they have celiac disease, so you want to make sure that you're communicating the preferences of your child. All right, so now we're going to talk about what students should be doing. So it's really important that kids are an active part of this process. So we want to make sure that the students know who is on their healthcare team. These are the people who will be helping them during the school day. So this might be the teachers, cafeteria staff, nurses, the coach. There are multiple people who can be involved, so we want to make sure that your child knows who those people are. We want your child to participate in those meetings so that they understand what the accommodations are and what to expect. So we want to make sure that the child clearly understands what the accommodations are they should be getting throughout the day, who to contact if they feel that they're having symptoms of an exposure, what to do if they think that someone made a mistake. If they are getting lunch at school or in the learning environment, we want them to be familiar with the process and procedures for how to get that food. So we want them to know exactly who to talk to, exactly who to go see, or exactly where to go to get that gluten-free food. We want students to tell their teachers if they're having symptoms of a gluten exposure, especially when they need help. We don't want them to be embarrassed or ashamed to ask for help. We want them to feel comfortable going to somebody to talk about how they're feeling. Finally, we really want them to take ownership of their celiac disease at school. We want them to ask questions if they feel that something isn't safe, and we want them to feel confident not eating something if they suspect that that food is unsafe for them and contains gluten. So this was a lot of information. Obviously, you can download all the slides, but you can also get all of this information in our Gluten-Free Diet Digital Resource Center, as well as tons of other information. We have videos, safe and unsafe food list, a bi-weekly podcast, regular classes, a news feed. There's tons of information. So if you haven't already downloaded it, please do. It's free in the Apple and Android marketplaces. You can scan the QR code on the screen with your phone and it will pop up right away, or you can search for the Gluten-Free Digital Resource Center in the various app stores. So how can our program continue to help? We can provide materials and education to schools and to families. You can download all of these materials from either the digital app or from our celiac program website at childrensnational.org/celiac. Our team is available to participate in individual 504 plan meetings and other advocacy efforts, and all you would need to do is email us at celiac@childrensnational.org. There is no charge for these services, just something that we do for the community. We can also provide web-based trainings for schools, food service providers, and other learning environments. So if you need help in the learning scenarios, please reach out to us. We are here to help. So I'm going to now turn it over for questions. I want to thank everybody for participating today, and all of our email addresses for our education team are on the screen. Again, you can submit questions through the questions field, or you can put them in the chat box, or you can email them directly to us. So thank you all again for participating today, and please do reach out if you do have any questions that come up throughout the process of the school year. We're always here to help.